Hi, I'm Dr. Suvarchalaa, Scientific Director with Ziva Fertility Centers. Vaginitis is a medical condition characterized by inflammation or infection of the vaginal tissues. It can be caused by various factors such as bacterial, viral, fungal, or parasitic infections, as well as some non-infectious factors also, like some irritants or hormonal changes also. Vaginitis can have several effects on fertility. It can be direct or it can be indirect. Let's look at some of them. Firstly, it can disrupt vaginal pH and microbiome. Now, the vagina has a delicate balance of microorganisms. These include beneficial bacteria like lactobacillus species, which can help maintain a slightly acidic pH, which is around 3.5 to 4.5. This acidic environment helps protect against harmful pathogens. Vaginitis, especially when caused by infections, can disrupt this balance by altering the vaginal pH and microbiome. An overgrowth of harmful microorganisms can occur, which can lead to conditions like bacterial vaginosis, yeast infections called as Candida vaginitis, for example, or trichomoniasis. Changes in vaginal pH and microbiome can affect sperm motility and survival, and potentially it can reduce fertility. The next effect of vaginitis is cervical mucus alteration. Vaginal infections and inflammation can affect cervical mucus production and quality. Healthy cervical mucus is essential for sperm transport through the cervix and into the uterus. Inflammation and excessive mucus production, which is seen in some types of vaginitis, can hinder sperm movement, making it more difficult for sperms to reach the egg. The next effect it can have is damage to reproductive organs. Severe or untreated cases of vaginitis, especially if they progress to pelvic inflammatory disease, also called as PID, can lead to inflammation and scarring of the reproductive organs, which include fallopian tubes, uterus, etc. Scarring or blockages in fallopian tubes can impair the transport of eggs and sperms, increase the risk of infertility, and also ectopic pregnancies. Vaginitis can also increase the risk of sexually transmitted infections. Some types of vaginitis, such as trichomoniasis, are associated with an increased risk of sexually transmitted infections. Untreated sexually transmitted infections like chlamydia, gonorrhea can lead to pelvic inflammatory disease, which can cause infertility by damaging fallopian tubes. Even more, if left untreated, sexually transmitted infections during pregnancy can result in adverse pregnancy outcomes, which include preterm birth and low birth weight. Vaginitis can cause discomfort and pain during intercourse. Vaginal infections and inflammation can cause discomfort, pain, burning sensation during sexual intercourse. This can lead to reduced sexual activity, which can cause problems in ability to conceive. It can also have psychological and emotional impact. Vaginitis can cause emotional stress and affect sexual relationships, potentially leading to reduced sexual activity and decreased fertility. Not all cases of vaginitis directly cause infertility, and many women with vaginitis can still conceive successfully. However, when vaginitis is severe, recurrent, or leads to complications such as pelvic inflammatory disease, it can have more impact on fertility. So, to treat vaginitis related fertility, it's very important that you go for a medical evaluation and then treatment. Treating of this problem, the cause of vaginitis, managing symptoms and preventing recurrences can help improve your fertility outcomes. If you think you have vaginitis or are experiencing fertility issues, consult your fertility specialist, who will conduct a thorough assessment and give you a personalized treatment plan. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.